and generally accepted accounting principles. Not to bore you, but the current debt is $22 trillion. There's a debt ceiling on that keeps being raised. And I think right at this point that we're hitting that again. But you accrue, that's what's called by accountants, the obligations that we're committed to that we would have to pay on an ongoing basis. And really we're not, because we're just borrowing more money. The total debt is $73 trillion just in operating assets. That's way more than a gross national product or a gross domestic product. So we're not generating enough revenue, of course, to pay our annual bills, but the deficit accumulates. And where does this debt come from? Well, it comes from, most of it is from Americans. They've invested through investment houses and groups in treasury bills. So the government's borrowing from its citizens. That's the biggest part of the 73 trillion. Of course, we owe China $6 trillion, and we owe Japan $2 trillion, and we owe some of our enemies money. And so when you start putting this on a balance sheet, you start to say, okay, well, yeah, we have a problem, but how are we going to solve that? Are we going to give tax increases, or are we going to give tax decreases? Are we going to believe in trickle down or trickle up? I'm a CTA, but I think our economists are really, stumped by government. Yeah. They don't really understand it. It's not a free market supply and demand equation. So that's only one of the problems. The problem of what's this debt cost? And the Federal Reserve sits behind our currency, and they're the guys that decide the interest rates. So in effect, if they are to raise the prime rate or the discount rate to its banks, it ripples into the treasury bills. Now, most of those are at fixed rates, but the new ones would be at the higher rates. So in effect, the Federal Reserve sitting there, and they'll increase the discount rate. They want to right now, will sink the ship, because we're not going to be able to pay China. And what if we don't pay China the interest? Are they going to then foreclose on Lake Michigan or take a piece of California? I mean, they could probably have. But anyway, I'm not trying to be cute here, but the leverage they have on our markets is not only the fact that they're getting our technologies and improving it and selling it back to us without any we don't even charge them for the market space that they have on our shelves, and Coca-Cola pays that. So we really don't need a tariff. We just need to charge them for accessing our consumers. And America is the consumer of the world. And we're talking now consumerism, not capitalism, not socialism. It's consumerism. And we should leverage off of that no matter what in our foreign policies. It's my feeling that we should stop building these wars of weapons of mass destruction, of which we've invested $3 trillion in and haven't used. We should direct that in paying down the debt. And that's only one part of it. The other part of it is the wealth that's accumulated in this country is astronomical. And so why not have them reinvest some of that wealth back into a great American enterprise and pay down the debt? And I call that not a tax. That's an investment on their part in the great American enterprise. And so that's only one facet. the deficit that the cost of health care is another huge problem that's being bantered around about Medicare for all, and it'll end up being Medicare for none, because at this point in time, we have 77 million baby boomers that are retiring at $10,000 a day to get Social Security, $7,000 a day to get Medicare. And where are we going to put all these other people on Medicare? Well, we all pay Medicare. It's not free. Nothing is free. We're all, and my position is the 169 million enterprising Americans pay all the bills.
Mm-hmm.
If you think about it, they pay all the bills. It isn't just the rich people or their companies or whatever. The enterprising Americans that work every day for these companies pay all the bills. The highest tax paid in the country is sales tax. And we're led to believe that the rich pay all the income tax. Well, they don't. If you go look and see what they pay, it's very little because of their foundations. We should be taxing those foundations. We should be taxing, getting some resources to pay down this debt. In healthcare, and that's really my specialty, at this point, we're paying $3 trillion a year on healthcare. The worldwide ranking of America is that they're 38th in quality and they're number 1 in cost per patient. And why is that? Well, first of all, we pay the providers on the basis of input data, not on outcomes. So we pay a hospital on diagnosis. We don't pay them on did they get the person well, and are they going to go home and stay home, or it's income rather than outcome. Well, how did this ever arise? Well, it was Blue Cross that started this whole thing in the 40s, and they said, hell, the employer will pay for everything. And the hospitals jumped on that, and then the physicians, and now it's nursing homes, and now it's amazing that the providers haven't said a word about what they're proposing. They love it. They're not accountable. They're not accountable for outcomes. They haven't even defined outcomes. To them, an outcome is a diagnosis. It's a stroke. Well, okay, what's it going to be after you get through it? What are we getting for our money from pharmaceuticals that bill out 8 billion pills a year to nursing homes, and we have more addicts in nursing homes than we have on the streets of America? And they're getting Oxy and Hydro, and they're getting patches, fentanyl patches. It's unbelievable. And the doctors don't even see these people. They call up a prescription and they expect it to be filled. Now, I've been in the healthcare business. We had 3 nursing homes. All we could do is fight with the surveyors because they wanted to tell us how to wipe rear ends. They were wasting our money on regulations that aren't really practical. Let enterprise solve the problems. But, oh no, the hands are tied. So what happens? We have the monopsony consolidating all of the healthcare providers to the point where the government will run everything. And then you don't have anything because you have no accountability. We couldn't find who's responsible at the VA. Can you imagine how we're going to find who's responsible for Medicare for all? That's going to cost us, instead of $3 trillion a year, it's $12 trillion minimum, 4 times what we're spending on Medicare. And we're not getting people well. We're not preventing anything. And we have 125 million chronic diseases, people with chronic diseases. 125 million of 330 million people have at least one chronic disease. But we have now 77,000 disease codes. Well, hell, the hospitals, the nursing homes, and the physicians love that because they just go in and pick out the one that pays the highest, has no relationship to cost, and they get paid without accountability. And if the patient dies, they die. If they can't go home, they don't go home. If they put them in a nursing home, they never get out. And we're forcing the patients that have some money going to the nursing homes to spend all their money, because the family doesn't have to contribute anything, put them on Medicaid, and the services then are cut in half. And in our situation, Medicare didn't pay unless they, in their definition, that it was medically necessary. And we had doctor's orders, we had hospitalization, we had all the proof. Finally, we developed, my son and I, software that we could appeal all the times that they denied our claims, and we won them all. Mm-hmm. And then they were all over me saying I was committing fraud and abuse, which was ridiculous.
Oh, wow.
So I'm just working down my list here. We have redundancy, and every state has a redundant agency that we have at the federal government. And they're all structured the same. They're all doing as far as I'm concerned, we could do without half of them. We could privatize half of those agencies at the state level, not at the federal level, and be way more effective. But when I was in Iowa, I applied to get on a committee, a subcommittee, or a committee that the governor gets as patronage, or gives out as patronage. And there was some 2,000 subcommittees and subcommittees attached to the state of Iowa. And you can imagine how you take 50 times that, what we've got. And you go there during session, you can't even find a parking place. Everybody's feeding off the anthem. So am I cynical? Yeah, I am, because I don't think it's working. Do I have solutions? Sure. Okay, Jerry, what the hell is your solution? Because I can go down the list of this. It touches education. It touches Medicare, Medicaid, Social Security, college debt, credit card debt, 46 taxes that we're paying, the Federal Reserve. But what I can do is talk about the solutions, if that seems to fit. I seem to be doing all the talking. Do you have any questions so far?
Yeah. So do you address some of these issues in the book as well as provide solutions?
Oh, yeah. Yeah, I have 9 books that deal with healthcare and its effect on society and on economics and politics. And I started out with Arthur Anderson in the early 60s. I came out of a small school in Iowa with a bachelor's in business and liberal arts. And I learned from almost day one I was assigned to hospitals. And so I've been in and around hospitals and healthcare for almost 60 years probably. I'm no youngster. But anyway, I got my real experience when Medicare got passed, and Arthur Anderson assigned us to Blue Cross. And we were consultants that were given the job to roll out Medicare. And we went to hospitals. They didn't want anything to do with us other than tell them how to bill. They didn't have any cost accounting. They still don't. They couldn't tell you what the census was because they weren't even tracking it. And then they started to track it when their billings were based upon patient days. So I've been through this evolution of seeing the hospitals get paid at first cost plus 5% because that's what Blue Cross was paying them. And then when the government finally realized that the costs were escalating at 16% a year, that they had to do something. So then some genius arrived at, well, we should pay for diagnosis. That's a product. Well, in effect, it's not a product. It's a problem. A stroke is not a product. And you'll still see that in some of the stuff that comes out of the government in terms of defining how they pay. But they pay on a per patient day basis. They're not paying on an episode of care, from the time they enter the system until the time they leave the system. They should be paid on the basis of progress, improvement, or at least preventing things. So, my background is cost